I'm going to show you in this video how to do some self-release or rolling of the hips. So we're going to hit the TFL, or these muscles in the front, and then we're going to go around in the glute medius and the glute maximus. So these can often get a little tied up, feel tight, feel like they're being overused, or just kind of feel good to get some pressure in them. So what we're going to do is we're going to take a ball. For the TFL, the tensor fasciae lata, it's kind of where a front pocket is. So you can feel in the front here, that's my hip bone, my anterior superior iliac spine, and so I don't want to be on that, so I'm going to come down from the bone until you can kind of feel some meaty muscle tissue here, and then here, that's the head of my femur, so I don't want to be on that either. So we're kind of in between these two bony points on that muscly stuff there. So that's going to be spot number one. And then after I work through that, I'm going to move back to kind of where my back pocket starts, and then into my whole glute max, or kind of the main buttock muscle there. So I'm going to lay on my side. I'm going to put that in my pocket, and I'm just going to get on the ball. And this is going to be potentially a little bit sensitive. I'm going to start with some small kind of side to side or small circles. As you're doing this, I don't want you to hold your breath or tense these muscles. Those are both assigned to your body that something is wrong. And so this might be a little tender, but we want it to be that hurts so good type of feeling. So I'm going to take some deep breaths. If I find a tender spot, I'm going to try to relax. I'm imagining my muscle, my hip kind of wrapping over the ball. That's a little sensitive for me there. I then want to add some movement. So I'm going to be on that tender spot. I'm going to bring my leg across and just kind of lift my foot up and down. So that's adding some rotational movement to that trigger point or that tender spot. Okay, so you're going to work this TFL for 2 to 3 minutes. Then I'm going to kind of come back here, and I'm going to be a little bit on my side. So I'm not on the bone again, but I'm a little bit on my side, getting more into the lateral hip or the glute minimus medius area. I'm going to be there. I'm going to set my hips on the ground. When I find a tender spot, I'm going to move this knee up and down. Again, taking some deep breaths, working through there. Okay, so 2 to 3 minutes on the side posterior. Then I'm going to lay directly on my back. Now I'm going into the main buttock muscle, and again, I'm searching for kind of a tender spot. When you find it, you're going to pause, try and relax the muscles, and just fly this knee in and out to the side to get some movement over that. You can lift your hips up a little bit. We're kind of exploring this whole area, trying to get some blood flow, get some desensitization, working through there. So that's rolling of the TFL and into the hip there.